Respiratory diseases and disorders affect the organs and tissues involved in breathing, including the trachea, bronchi, bronchioles, alveoli, pleuri, and the nerves and muscles of respiration. These conditions can range from mild and self-limiting, such as the common cold, to life-threatening diseases like bacterial pneumonia, pulmonary embolism, tuberculosis, and lung cancer. Asthma, a chronic inflammatory disease that causes breathing problems when the airways become narrowed by inflammation or blocked by mucus. It affects about 25 million people in the United States. Chronic obstructive pulmonary disease or COPD. This includes chronic bronchitis and emphysema, characterized by airway obstruction due to inflammation and constriction of the bronchial tree. COPD is the sixth leading cause of death in the United States. Cystic fibrosis, a genetic disorder that affects the lungs and other organs, leading to the production of thick, sticky mucus that can clog the airways. Lung cancer. One of the most significant causes of cancer deaths, often linked to smoking tobacco. Tuberculosis, an infectious disease caused by bacteria that attack lung tissue and can spread to other parts of the body. Pneumonia, an infection that causes inflammation in the air sacs of the lungs, leading to coughing, fever, and difficulty breathing. Bronchitis, inflammation of the bronchial tubes, which can be acute or chronic, often caused by repeated exposure to irritants like cigarette smoke or pollution. Respiratory physiology involves the transport of oxygen from the environment to the cells within tissues and the removal of carbon dioxide in the opposite direction. This process includes ventilation, the in and out movement of air in the lungs, perfusion, the circulation of blood in the pulmonary capillaries. Gas exchange occurs in the alveoli where oxygen diffuses into the blood and carbon dioxide diffuses out. Several factors can increase the risk of respiratory diseases and disorders, including tobacco smoke, a major risk factor for COPD, lung cancer, and other respiratory conditions. Air pollution can irritate the airways and contribute to respiratory infections. Occupational chemicals and dusts. Exposure to harmful substances in the workplace can cause respiratory issues. Frequent lower respiratory infections, especially in childhood, can lead to chronic respiratory conditions. Treatment for respiratory diseases often involves avoiding trigger, reducing exposure to irritants and allergens, symptom control, using bronchodilators to relieve symptoms, inflammation suppression, treating with corticosteroids in severe cases, lung transplantation, for end-stage lung disease, though this remains a last resort.